Katrina is taking a walk when she trips and cuts her hand. If you have a small cut, first apply pressure to the wound to reduce the bleeding. Applying pressure helps constrict the blood vessels, preventing blood from flowing through. Then, clean the wound with mild soap and water, removing any debris. Do not use rubbing alcohol or hydrogen peroxide to clean the cut, which can slow the healing process. Place a bandage against the length of the cut to help close the wound and protect against infection. Remember to change it frequently to keep it clean. To recap, apply pressure to reduce bleeding. Clean with mild soap and water, and use a bandage. Always see a doctor if the injury was caused by a bite or if you think it has become infected. Signs of infection include swelling, pus forming, or increasing pain. More serious cuts should not be treated at home. Call 999 or your local emergency number if you are unable to stop the bleeding, the cut is very large, you have trouble moving body parts, have severe pain, or still have debris stuck inside the cut. But if your cut is not as serious, it should heal within about 2 weeks. Aaron is eating a hot dog when he starts choking. If you see someone choking, the first step is to determine how serious it is. Choking happens when someone is not able to breathe due to a fully or partially obstructed windpipe or throat. It will often happen when food gets lodged when swallowing. If you think someone is choking, ask them, "Are you choking?" If they can reply, it means their throat is only partially blocked. They should be able to clear it on their own by coughing. However, if they cannot reply, cry, cough, or breathe, then it means that their throat is fully blocked. They need your help. Have the person bend forwards and stand behind them. Use the heel of your hand, the area between the palm and the wrist, to hit them firmly between the shoulder blades up to 5 times. This creates a strong vibration which can dislodge the food. If they are still choking, give up to 5 abdominal thrusts. This is also known as the Heimlich maneuver. Do not try the Heimlich maneuver on a baby under 1 year old or pregnant woman, as it can be dangerous to them. Otherwise, stand behind the person, wrap your arms around their waist, and bend them forwards. Make a fist with one hand and place it right above their belly button. Put your other hand on top of your fist. Then, pull sharply inwards and upwards up to 5 times. If the person is still choking after doing 5 back blows and 5 abdominal thrusts, call 999 or your local emergency number. Continue doing 5 back blows and 5 abdominal thrusts until help arrives or until their throat has been cleared. To recap, if you think someone is choking, first ask, "Are you choking?" If they are, give up to 5 back blows and then 5 abdominal thrusts. If they are still choking, call 999 and continue alternating back blows and abdominal thrusts until help arrives. Now, Aaron cuts his hot dogs. Bernard is cooking dinner when his hand brushes against the hot pot. If you've been burned, the first step is to determine what type of burn you have: first degree, second degree, or third degree. These names are based on the severity of damage to the skin. First degree burns only affect the top layer of skin and are characterized by redness and minor inflammation. Second degree burns affect the next layer of skin and are characterized by the symptoms of first degree burns, as well as blisters. Third degree burns affect the third layer of skin and even deeper tissues. These burns can make the skin look charred, with black and white patches. These are the most serious type of burns. If you think you or someone else has a third degree burn, call 999 or your local emergency number. When waiting for help to come, rest and raise the injury above the heart. It seems that Bernard has a first degree burn. The first step to treating first degree burns is to cool the burned area with water for 10 to 15 minutes. This will help reduce swelling, pain, and chance of scarring. Make sure not to use cold water or ice, which can do further damage to the exposed tissue. To protect the burn from infection, cover it with a non-sticky bandage. Cling film or plastic bags are ideal as they don't stick to the damaged skin. Finally, if you have a second degree burn, follow the previous steps mentioned and see a doctor afterwards. If you ever see signs of infection, such as a smell coming from the burn, be sure to see a doctor as well. To recap, if you have a third degree burn, call 999. And to treat first and second degree burns, cool the area with cool water and protect the burn with a non-sticky bandage. Well, there go Bernard's dinner plans.